This is Dr. Martin's supplemental lecture on cranial nerves. This is the second supplemental lecture on cranial nerves. We're going to finish them up in this particular lecture. And so I'm going to start with cranial nerve number 10, which is called the vagus. And the vagus is actually a very important cranial nerve. We're going to talk about it later on when we bring up the cardiovascular system and the digestive system and some of those other organ systems that have organs in the abdominal cavity or the thoracic cavity. So let's take a look at the vagus nerve. It has some motor functions. In other words, it controls the pharynx and the larynx. So it will control functions such as swallowing, the gag reflex requires a functional vagus nerve also, and speaking also involves the vagus nerve. Now, we also have some neurons that are part of a nervous system division that we haven't really talked about yet. I mentioned it in the very beginning when I introduced the nervous system. This component is called the autonomic nervous system. And it is not under voluntary control. So it's part of the nervous system that you really don't have any knowledge of, no conscious knowledge of. But this particular nerve will carry a number of autonomic fibers that innervate the viscera. In other words, lots and lots of organs. So the heart, the digestive organs, the lungs, and so on. Many of the bladder, and so on. So we'll come back to the autonomic nervous system. But remember, this was a system that contained or was subdivided into sympathetic fibers, and those are going to control what we might call fight or flight types of reactions. The other component of the autonomic nervous system is called the parasympathetic, and it regulates sort of the opposite set of reactions or behaviors. And so we sometimes summarize that as saying, with the saying, rest and digest. So digestive functions are definitely part of the parasympathetic system. Sorry. Okay, so that is cranial nerve number 10. We have 2 more to go to finish these out. So we're going to take up cranial nerve number 11. Cranial nerve number 11 used to be called the spinal accessory. It's now simply called the accessory nerve. And it is a pretty simple nerve. It controls motor functions, so we'll call it a motor nerve. It regulates two important muscles, the sternocleidomastoid sternocleidomastoid and the trapezius. So if you remember, the sternocleidomastoid is that muscle that kind of forms a V from the mastoid process of the skull coming down to the point of the sternum. It also has another component that comes from the mastoid down to the clavicle. And so that's going to be important in turning the head or bringing the head down to the trunk, and to test someone for the function of that. You would simply ask them to try to do that, or you would place some resistance and ask them to try to press against that resistance. The trapezius is involved in stabilizing the scapula. So you would look at a patient's position of the scapula to make sure that they are in normal position, maybe aren't tilted one way or the other, indicating a weak trapezius. All right, so that's spinal nerve number 11. And now we come to the very last spinal nerve, which is spinal nerve number 12. And this is called the hypoglossal. And so this is, again, this is a tongue muscle. So this is a motor nerve that controls the tongue. The tongue is a muscle, a pretty thick muscle that's covered with sensory epithelium. So if you are trying to test a patient for function of this particular cranial nerve, you would simply ask them to stick out their tongue, and if their tongue deviates one way or the other, that indicates that you've got a weakness on one side. Remember, these are cranial nerves that exit from the right and left, so you have a weak hypoglossal on the right or the left. Okay, so that is the end of the cranial nerves. I know it's a lot of information. I really advise that you make index cards, flashcards for each of these, and you can expect a matching or multiple choice questions on the next test about these cranial nerves, both the name, the Roman numeral, and the functions.